Hello, let's discuss the anatomy of the posterior compartment of the forearm. So the forearm is divided into interior and posterior compartment by radius, ulna and the interosseous membrane. Okay, so the interior compartment is called the flexor compartment and the posterior compartment is called the extensor compartment. So today we will be discussing about the muscles, the nerves and the blood supply of the posterior compartment. Okay, so the posterior compartment has total of 12 muscles. 7 of them are superficial while 5 of them are deep. So the superficial muscles in the posterior compartment are the most lateral to medial. So the most lateral is brachioradialis, then medial to it is extensor carpi radialis longus. Then after it, there is extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, and anconeus. Okay, so the superficial muscles of the posterior compartment of the forearm are innervated by the posterior interosseous nerve, PIN. Posterior interosseous nerve. It is the deep branch of the radial nerve. Okay, except the three muscles which are not supplied by the posterior interosseous nerve. They are brachioradialis, extensor carpi radialis longus, and anconeus. So these three muscles are not supplied by posterior interosseous nerve. Instead, they are innervated by the radial nerve itself. Okay, so this is the radial nerve in the lateral most part of the cubital fossa, and in the cubital fossa it divided into its deep branch which travels to the uh, posterior compartment of the forearm to supply the muscle. This deep branch is called posterior interosseous nerve, while this one is superficial branch. Okay, so this is the deep branch of the radial nerve and this is the superficial branch. So the muscle of the posterior compartment are mostly supplied by the posterior interosseous nerve, except the brachioradialis, extensor carpi radialis longus, and anconeus. They are supplied by the radial nerve itself. Okay, so this is the extensor compartment or posterior compartment superficial muscles. Mostly the muscles in the posterior compartment are responsible for the extension of the wrist or hands and fingers. Okay, so these are the superficial compartment muscle, while the deep compartment muscles are 5 in number. Okay, so now we will be discussing or looking into okay, so these are the deep compartment muscle. The first one, which is most proximal muscle in the posterior compartment deep layer, is supinator muscle. Second one is abductor pollicis longus, this one. Then lateral to it is extensor pollicis brevis. Then this one is extensor pollicis longus, and this is extensor indicis. Okay, so these 5 muscles are in the deep layer of the posterior compartment and they are innervated by the posterior interosseous nerve. Okay, so this is that posterior interosseous nerve. Okay, so now we will discuss the muscles of the posterior compartment one by one. Okay, so first we will discuss about the brachioradialis. Okay, this is the brachioradialis muscle. Okay, most of the muscle of the posterior compartment originate from the common extensor origin, which is just in front of the lateral epicondyle of the humerus, except the few ones which are not originated from this common extensor tendon. One of them is brachioradialis muscle. So from where the brachioradialis muscle originates, so it originates from the upper 2/3 of the lateral supracondylar ridge of the humerus. So it originates from the supracondylar ridge of the humerus. Okay. So this, you can see, this is the supracondylar ridge of the humerus, and from the upper 2/3 the brachioradialis muscle originates. Okay, and then it uh, insert on this process on the radius, which is called styloid process. So it insert on the styloid process of the radius, and the nerve supply is radial nerve itself, innervate it. And what is the action? So it helps in the flexion of the elbow. Okay, flexion of the elbow in mid prone position, and it also helps in initiation of pronation and supination. Okay, so this is about the brachioradialis muscle. Then after that is extensor carpi radialis longus. It also it doesn't originate from this common extensor tendon. It originates just below the brachioradialis muscle origin. It originates from lower 1/3 of the lateral supracondylar ridge of the humerus, and it insert on the second metacarpal bone and third metacarpal bone. Okay, but mostly the second metacarpal bone. This is the insertion, and it is innervated by the radial nerve itself. Okay, and it helps in the extension of the wrist joint, and it also helps in the abduction of the hand or wrist joint. Okay, so that is the second one. The third muscle is extensor carpi radialis brevis, and it originates from the common extensor tendon, and then it insert on the second metacarpal bone. Okay, second metacarpal bone, this bone, second metacarpal bone, this is the insertion of the extensor carpi radialis brevis. Okay, and it is supplied by the uh, it is supplied by the or innervated by the posterior interosseous nerve, which is the deep branch of the radial nerve. Okay, and it causes the extension of the wrist joint. Okay, and it also helps in the abduction of the hand. So this is extensor carpi radialis brevis. Then the extensor digitorum, it originates from the common extensor tendon, and it inserts on the extensor expansion of the medial four fingers. Okay, so it insert on the extensor expansion of the medial four fingers. Okay, so these are the insertion point of the extensor digitorum. Okay, extensor digitorum, these are the central bands and these are the lateral bands. Okay, so I will also show the tendons of the extensor digitorum. Okay, so the extensor digitorum, okay, sorry, I will show you the letter. So extensor digitorum inserts on the medial forefinger through extensor expansion, and it is innervated by the posterior interosseous nerve, the deep branch of the radial nerve, and it helps in the extension of the medial four fingers. Okay, and also it helps in the extension of the wrist. Then the extensor digiti minimi. Extensor digiti minimi originates from the common extensor tendon. Okay, common extensor, this muscle, and it insert on the little finger through extensor expansion. Okay, so it insert on the this the little finger. Okay, it insert on the extensor expansion of the little finger. Extensor digiti minimi, this is extensor digiti minimi. Okay. Then the extensor carpi ulnaris. Oh, okay. So the its action is, it basically extend the all joints of the little fingers, and it is innervated by the posterior interosseous nerve. Then the extensor carpi ulnaris. This is extensor carpi ulnaris. It originates from the common extensor tendon, and it inserts on the fifth metacarpal bone. Okay, so the fifth metacarpal bone, extensor carpi ulnaris. This is the fifth metacarpal bone, and here the extensor carpi ulnaris insert, and it is innervated by the posterior interosseous nerve, and it helps in the extension of the wrist and abduction of the wrist or hand. Okay, so abduction and extension. Then the anconius, this little muscle, just like the brachioradialis and extensor carpi radialis longa, it its origin is not from the common extensor tendon. It originates from the back of the, okay, anconius, from the back of the lateral lateral epicondyle. So this is lateral epicondyle, and from the back of the lateral epicondyle, anconius muscle originates. Okay, and it inserts on the this ulna, lateral surface of the olecranon process. Okay, so it inserts on the ulna, and it is the it helps in the extension of the elbow joint. So the main extensor of the elbow joint is the triceps muscle, but the accessory extensor of the elbow joint is anconius muscle. Okay, and it is not innervated by the posterior interosseous nerve. It is innervated by radial nerve itself. Okay, so these are about the superficial muscles. Then the deep muscles. The first one is this muscle, which is supinator. Supinator muscle. Then the abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. All the muscles in the deep compartment is innervated by the posterior interosseous nerve. Okay, now we will discuss about the individual muscles. Okay, so the supinator has two origin. Okay, it originates from the two head. Okay, it originates from the two head, the superficial head and deep head. Okay, superficial head originates from the lateral epicondyle. Okay, so this is the superficial head of the supinator. Okay, which originates from the lateral epicondyle, while the deep head from the supinator crest. Okay, supinator crest of the ulna. Okay, of the ulna, and it inserts on the lateral surface of the radius. Okay, so it helps in the supination. Its main function is supination of the extended elbow joint, and its supply is posterior interosseous nerve. So it originates from the two head, one from the lateral epicondyle, and the other is from the supinator crest of the ulna, and it insert on the lateral surface of the upper radius. Okay, and it helps in the supination. Between the two heads of the supinator, the posterior interosseous nerve travels from the cubital fossa to run in the posterior compartment of the forearm. Sorry. So this is the about the So this is the posterior interosseous nerve, and it passes in between the two heads of the supinator muscle. Then we will talk about the abductor pollicis longus. Okay, so the abductor pollicis longus originates from the posterior surface of the radius, interosseous membrane, and posterior surface of the ulna. Okay, so posterior surface of the radius interosseous membrane and ulna, and then it insert on the base of the first metacarpal bone. Okay, its nerve supply is posterior interosseous nerve, and it helps in the abduction of the thumb. Okay, this is the abductor pollicis longus. Then the abductor extensor pollicis brevis. Extensor pollicis brevis originates from the posterior surface of the radius and the interosseous membrane, and it insert on the base of the proximal phalanx of the thumb. Okay, so this is the insertion of the extensor pollicis brevis, and it is supplied by the posterior interosseous nerve, and it helps in the extension of the metacarpophalangeal joint of the thumb. This is extensor pollicis brevis. Now then the extensor pollicis longus, it originates from the posterior surface of the ulna and the interosseous membrane, and it insert on the base of the distal phalanx of the thumb. Okay, its nerve supply is posterior interosseous nerve, and it causes the extension of the all joints of the thumb. Okay, so the thumb has two extensor pollicis brevis and extensor pollicis longus. Okay, then the extensor indicis originates from the posterior surface of the ulna and interosseous membrane, and it get inserted on the extensor extension of the index finger. This is index finger. Okay, so it insert on the extensor extension of the index finger. It is supplied by the posterior interosseous nerve, and it causes the extension of the all joints of the index finger. Okay, so these are the 5 muscles of the deep compartment of the forearm.